You gotta really dig in there to get that out of there. But first visit, do we really want to kill? That's so mean. I usually spread this out a little bit. There we go. Beautiful. The upper neck is brand new up here. No disc injury at the top, and then obviously at the bottom we have the spinal cord is being hit because of the disc material coming out, and also bone spurring above and below. Okay.
So when I have to come back again?
So your first recollection of this scoliosis, at least starting, was back when you were a teenager?
Yeah, young teenager.
Young teenager. But then when you get to lumbar 2, he's almost shifted over about I don't know, like half inch.
Wow, that was something.
Cool. Those bones have not moved in a long time.
It is really interesting.
Yeah.
This is the mostly the part it can give me the pain actually.
Right. My point is that all the other levels are very minimal and not causing problems, but you have one. So when you bend exclusively in one area, the bones will grow. And when it's like, do I have this model here? You call that person. You know, you've been bending, you know, part of your neck is locked, and so all the bending has been happening in one small area. Do you understand? Because this part is locked above and usually also below. So all the bending's happening in one spot, and then that constant stress in that one spot is making the bones grow. When the bones start to grow, they hit the nerve, and then your body rounds forward to open up that hole. That's why the head has gone forward. Is it thumb and index finger, shoulder?
I have like some
Weakness?
weakness in this left hand actually.
How long have you been dealing with that?
January 1st.
Just started. So
Yeah, like almost 4 months.
what have you been doing through your life? What's your work been like for the last 30 years?
Travel business actually. My phone is always on, like that way. So that's the reason I think so.
Gotcha. But not a lot of, not lifting, not
No,
doing a
no,
lot
no,
of-
no, no, no.
Just
no.
just traveling and phone.
Traveling and phones, yeah. And then I had like my 2 back surgery also, and the L5S1.
You had a fusion?
No fusion.
Just
only the
Clean out
area.
surgery.
Yeah.
Okay, how long ago was that?
One in 2007 and another one is 2009 because 2007 wasn't like success 100%.
I understand.
So I had to go for other surgery. December 30, I had like couple of drinks and then I
Gotcha.
slept.
Weird.
I don't know, like my neck is fell down like a different way.
All right. Just real quick, let me just go over this and we'll get to work. So the neck is designed to work from the top. This is where most of the work should be happening. So the atlas axis is where 60% of the work should be happening. So it shouldn't be possible to overstress and grow that bone down here and injure the disc in your lower neck without the upper neck working properly. This wouldn't have overstressed. The upper neck is brand new up here. No disc injury at the top, and then obviously at the bottom we have the spinal cord is being hit because of the disc material coming out, and also bone spurring above and below. I think they mentioned a little bit. So you have probably a whiplash 30 years ago that allowed some of the bones to actually translate a little bit. So there's a little bit we call anterior listhesis. Some of the bones are sliding forward and back. That allows the disc to age too quickly. So we have a whiplash. The vertebrae the ligaments that hold the vertebrae stacked get torn, and that creates a shearing force on the disc, which then you sleep wrong or some wrong movement, and now you're hitting the nerve. But this was like a cliff edge. You were with it. That bone spur took decades to form, and then it's the straw that broke the camel's back. You finally reached that threshold, and then it started in January. I understand that's when you hit it, but this has been growing and festering for decades. Take a deep breath in. Head back for me. Yeah, deep breath in. I got you. Head back. Exhale. Let it go. Deep breath in. Let it go. Exhale. Let it go. Okay. About 50% mobility. You should have a lot more. I know. Stay there. It's easy for the thoracic cage to become locked, because the thoracic cage has all these ribs to protect your organs. And so it's kind of like, I don't know, gaining weight. It's easy to sit on the couch and eat food, right? It's hard to go to the gym and exercise. It's, you don't do anything and your back becomes stiff. If we don't participate in keeping it loose, it'll lock up. And so the more rigid your middle back becomes, the more your lower neck overstresses and your lower back overstresses. And so it's vital that we keep those areas moving. I'm going to massage here for a second. Got a lot of stiffness up here at the top. So nobody should ever adjust your lower neck. I would hope that whoever worked on you didn't. As a patient, it can be difficult to know where I was. I don't know, Ed, the guy turned my neck. You know, as a patient, it's sometimes, you know, it's hard for a patient to perceive where they're adjusted. But as your doctor, I want to tell you that there is a big difference between being adjusted in your upper neck and being adjusted in your lower neck. This knot up here in your upper neck is essentially like a clog or like a road construction. You know, there's been construction and delays up here. Your neck is supposed to be bending up here, and for the rest of your life we're going to try to teach you and then give you tools at home to use as reminders. It's like, well, Ed, it felt good for a few days and then my back went back to moving the way it was before, and this is disheartening because it only worked for a day or two. And that's where, yes, we have to give you tools that allow you to retain the mobility. And then the more you get adjusted, the more you stretch, the longer your leash will get, the longer you will be able to, for your spine to remain moving the way it's supposed to without needing to constantly be adjusted. The leash gets longer. Right up here. And then we want to be careful when we're adjusting the upper neck that we only move the upper neck when we have a severely injured lower neck. Why statistically it's always the same usual suspects? Cervical 5, 6, and 7, and lumbar 4 and 5. It has to do with forward head posture, being on your phone, bad posture, changing the mobility pattern whereby the lower neck is the initiator of movement. And so your lower neck is the first to arrive, the last to leave, and is always being asked to do everything. The stress on that area has been compounded. Okay. Please.
So does he has to keep doing to make it this, every day? Because if he doesn't exercise, it's going to go back to normal.
Well, it's going to be passive. It's not so much an active, exercise. It's more stretching. The cervical lordosis, which means the arch that your neck should have, the loss of that curve is what preceded all of these problems. So the first thing that happens is we lose the right alignment. Now we create mechanical imbalances whereby the lower neck is mechanically overstressed. So the more we get his neck back into a curve, it will take the mobility out of his lower neck. Also, the cables, the nerve roots that come out the side are actually able to be flexible and loose when there's a curve in your neck. So even though there is stenosis, the nerve has the ability to kind of move more. If there's a curve in your neck, the nerve has flexibility to kind of rope-a-dope and move with the punches versus being rigid and then just taking a punch and not being able to, kind of move with it. We call that tethering. Nerve root tethering happens when you lose the curve in your neck. I want to fix the root cause, which is if his atlas was working, if the axis was working and the upper neck was curved, the neck was curved, then you wouldn't have these problems. These problems had causes. If you make a joint do double the work, it's going to need to be double the size. So mechanically, you were asking a joint to do double the work that it was intended to do, and so it grew. So going in there and scraping off the bone spur, the body's going to say, oh my gosh, put an even bigger one in there. What the heck? You know how much stress that area's under? There was so much stress that we lost our bone spur. So apparently we need to put a bigger one in there. And so it doesn't work. Even mechanically, or even the physiology of how bone spurs grow is based on acidity. So acid is negatively charged and calcium is positively charged, and opposites attract. And so leaving acidity along your spine is what attracts the calcium out of your blood. And so bone spurs grow because of pain, lactic acid, inflammation, kind of like leaving love bugs on the paint of your car, bird poop. It's the acidity that causes the damage. You understand? That's what causes the growth of the bone. And so how do you stop bone spurs from growing? Get rid of the acidity, right? The lactic acid is from the continual stress, the inflammation, the damage. And so spread out the work so that no one vertebrae is being constantly stressed. Okay. I got you. Really easy. There you go. How'd that feel? You okay?
Yeah.
Yeah. So we're not moving the injured area, right?
Okay.
You're saying the parts of his spine that are young, sure, that didn't hurt, right? Because they're not injured, right?
Mm-hmm.
And if they can work more and more, you're not going to notice that injured guy. But the difficulty is that you should have had this done at 20 or a teenager. You understand? So you've lived a long time with the wrong alignment, with the wrong mobility. It's like you smoked cigarettes for 30, 40 years, and now I'm going to take the cigarettes away, and you're not going to think his body's going to like that? Think he's just, oh yeah, I'll give him up. No. Old habits die hard, right? The old habits take a lot of coercion, and this is why I adjust children. Why do you adjust kids? What? They have problems? No, because why do you brush kids' teeth? Because we don't want to have problems in the future. And you don't wait till your car has a smoke coming out the hood before you take it in for service. You check your oil and your tires and you maintenance things. You don't just wait till there's a problem. But our world literally covers up check engine lights, right? That's what we're doing. If you got a check engine light on your car, we're told to put black tape over it. 100 years ago, if somebody busted their ankle, they didn't keep walking on it. But now we have enough painkillers that you can keep walking on that busted leg, right? And so we've allowed people to abuse themselves to a level never really seen before. We've never gotten this. We're living longer, one. People didn't live as long as we did 120 years ago. And now we have the medication to cover up a problem. So we're having really pains that really haven't been experienced by humans ever before. I got you. I got you. There we go. Beautiful. Have that done once a week, the rest of your life would be in good shape. That's really all you need. It's really all you need. It's moving. You okay?
Yeah.
Yeah. No, if you could just keep that upper neck, I've seen way worse than this. I've seen way worse where it takes me a lot longer to get the atlas moving. That's your atlas. It's moving. So we call this thoracic outlet syndrome. Has you heard that term before? No?
No.
Okay. So there's the nerve that goes to your arm has to channel, the brachial plexus has to channel through a funnel to get down to your arm. That's why he's feeling it in his hands. Mm-hmm. We call that the thoracic outlet. There's three components for what can impinge or push on the nerves as they're going through that outlet. One, the vertebrae in the neck is in the wrong position, which we just addressed face down, face up. We just adjusted his neck. The bone's in a better position. Two, the rib in the upper back is elevated. So we need to push this rib down to open up the channel a little bit. And then three, the actual muscles and tissue that are around the nerves are inflamed. And that's what the Gua Sha is going to do. We're going to clean the bruising and acidity that the nerves are sitting in. Does that make sense? So getting the actual tissue itself cleaner. The roots of your neck are in here. So what made all the acidity? Well, the posture. Because his head's forward, because of the opening of the hole and the compensation, the muscles are working harder than they're supposed to be.
I'm feeling like better every day, but
Yes, sir.
I hope like you fix my.
I'll give you everything I got. I sleep well at night because I give my patients my all.
No, I see like you know.
This is acidity.
Okay.
See the mark?
Yeah.
So 30%, 20, 40%, who knows? Some percentage of his pain is coming from the bruising.
Oh.
Do you understand? Because the area is so tight, it's like choked. The blood flow has a hard time getting into tight areas.
Okay.
The tightness is from his posture. So taking a muscle relaxant isn't going to work because his head's still forward, right? The posture creates the tension. The nerves are sitting in this acidity. And so they're irritated chemically because of the soreness that the tissue that they're sitting in, irritates them. So getting rid of the acidity, this is where Epsom salt, a lot of water, get a cup with Epsom salt, let some salt dissolve in the cup, rub that into the skin, then take a towel, soak that in the salt water, and then lay that over these marks, or you can get in a bathtub, a couple cups into a salt tub. You want to the faster these marks go away, the faster he's going to feel better.
Okay.
The mark is why he's pointing. When he pointed earlier, it's not a coincidence that where he's pointing is where you're seeing these marks. The mark is the evidence of the internal bruising, inflammation. So because the muscles are working way harder than they're supposed to be, they're producing a lot more acidity. Lactic acid is the exhaust that muscles produce when you use them. That exhaust is inflammatory, it's acidic. Yeah, this is what caused, I know, I gotcha, yep. But you're gonna start feeling things that are trapped in here, even like the diaphragm, your lungs, they all drain based on, yeah, I wouldn't be surprised if there's lung issues because of how tight his chest is. It'll cause organ dysfunction. Look, I'm rubbing right here, it tickles because he's not used to feeling this area move. It's been stiff for so long that I'm gonna start asking it to function the way it's supposed to, and it's gonna make the nerves in the area start sending signals that he's not used to feeling. So we need to have this area function the way it needs to. There we go. And the tightness in your middle back is the reason ultimately for why his lower back overstressed. The head being forward makes the middle back tight. So there are domino effects essentially, that the upper neck going forward head posture is the first problem that happens in our spine. The head going forward, the loss of curve, then creates plantar fasciitis, causes shin splints and knee problems and hip problems, and so this is why the first chiropractor's son, B.J. Palmer, almost worked exclusively on the upper neck. The amount of influence that the upper neck has on the whole body is immense. And so if we can get the upper neck aligned properly, then I don't believe in exclusively working on the upper neck, but I do understand what BJ was getting at, which is that you have to work on this. And it's almost like half the visit will be the upper neck and then half the visit on everything else. Do you understand? You spent half the visit on 2 bones and then you spent the rest of the half the visit on 20. Correct, because those 2 up the top are way more important. Is the left leg worse? Is the left leg was more symptoms? Is that correct?
Left hand, yeah.
But the left lower back, was the left worse?
Pain or back pain?
No big pain.
I know,
No,
but
before-
15 years ago, was the left?
The left. Yeah.
The left was worse?
Yeah.
Correct. You understand why I know that?
Yeah.
Look at his back. See how this is higher?
Mm-hmm.
So his right middle back is really stiff. This was not as bad, but right here is the worst part. The stiffest part is going to make the opposite lower overstress.
Okay.
See, this is more beat up here because he's essentially in right avoidance. I'm exaggerating, but he's tight on the right and he's tilting to the left. And so you're going to grind.
Oh, okay.
You understand? The left lower is going to be under extra stress because he's avoiding.
Yeah, he did use to have leg pain.
It'd be left leg pain
Yeah.
because
Arm pain.
But my point is that this is the problem.
Oh, okay. So
The problem is here. That was just the symptom. The cause is right here, there, and nobody showed you this lump right up here is the problem. This is what caused the lower back to overstress. All right. And like I said, tomorrow, now my middle back on the right's killing me. Yeah, because Ed went in there and beat it up and asked it to function, and the area said, I had old injury in here, and I quit a long time ago. Yeah, wow. This is still me being nice, I know. Because I want to go much. Oh no, Ed. You got to really dig in there to get that out of there. But first visit, do we really want to kill? That's so mean. I usually spread this out a little bit, but yes, somebody, you got to really. Oh, okay. No, I can just feel all the. Right there. Mm-hmm. There, yep. Okay, take a break. The difficulty is that his lower neck is so loose, so the question is how can we loosen this without aggravating the lower neck or lower back? And that we're going to have to do with some books behind his head to limit the depth so we can just work on the areas we want to without aggravating the areas that are injured. Tension rotator cuff here. So even the rotator cuff is going to be under more stress. So part of what's going on is the thoracic outlet is opened up a little bit by rolling your shoulders forward. And because his shoulder's not in the right position, you'll wear out your labrum or you'll injure your rotator cuff, but that's really a result of the postural change that's happening because of the neck injury. So the neck injury causes the shift puts stress on his shoulder and the muscles around the shoulder. And so someone will say, you're injuring your rotator cuff, and it's like, well, yes, that's true, but it's because of his alignment that was changed because he has a disc injury, bone spurs. I'm just feeling a lot of tension around his shoulders, but this is here because of the shift. And then we have, causal pains, and then we have what we call compensatory pains, right? Pains that are a result of the compensation. Simple analogy is like a broken ankle. If you break your right ankle hurts, and so you then compensate and throw your weight to your left ankle. Now, over time, if you keep doing that, your left ankle starts to hurt because your left ankle is doing double than what it was supposed to be doing. So what's the problem? Should we fix the left ankle, or should we go back and fix the right ankle? Right? That's the true problem. Well, no, my right ankle doesn't hurt anymore. My left ankle's killing me. That's because you're avoiding the right ankle. The left ankle's not doing anything wrong. It's just doing double because you're in avoidance. The true problem is the old injury to your right ankle that made you avoid it, and now you're abusing the left, right? So everybody's trying to focus on the left ankle. I'm going, that's not the problem. You're in avoidance. The problem's right here. He's got this all at tension in here. It wouldn't take much to rip it. The tension's from the posture, though. And everybody's going to focus on the tears that'll happen because of the alignment, not the alignment itself. That's the injury on your right side.
Okay.
That's what caused your left lower, and then yes, of course, above and below. But that's all this restriction up here is the problem. Okay.
We'll see what you think.
You gotta real punch me.
He has a big ear.
It's okay.
Yeah.
A little bit of click. Little click. Okay. 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 It's okay. Come with me. Right over here. There you go. Lay back, I got you. Yeah, perfect. You got it. Relax, relax, breathe. Got a middle upper neck. Sometimes I take my hand, put it on my forehead, try to push. Is okay? Okay. And then put your hand back here. I understand if your lower neck or your arm already hurts when you get on this. If it starts getting worse, we got to get off. Do you understand? If it just is uncomfortable in your upper neck or your middle neck or upper neck, that's okay. But if it starts hurting worse in your lower neck or any symptoms in the arm start getting worse, get off. If it's been more than a month since you've been adjusted, I caution using it without somebody making sure that your upper neck is moving. Meaning if your upper neck gets tight and we put the DenRoll on it, there's a possibility that the upper neck doesn't move and the lower neck moves. And that does require some level of continual care to make sure that he can do this at home safely. The longer you've done this, the longer you've been adjusted, the less you'll need to be adjusted, and the more you can just do this at home as your toothbrush to take care of yourself. Well, you okay?
Yeah.
Any questions or
No.
This would usually, like I said, if you want to find somebody upper neck, there are chiropractic biophysics on this website. There are idealspine.com. Maybe there's somebody up there where you live that they obviously know about DenRolls. This is not a unique device to me. They've been there's a lot of other chiropractors that use these devices. We need to have his neck adjusted. I would obviously leave they need to see that MRI. Hopefully be of the same narrative. Let's not adjust that area. Let's leave that alone. That's injured. Let's get his upper neck moving, his upper back moving. Let's get his curve back in his neck. And he's going to feel better simply by not looking at that area anymore. And let's see if that can buy you 20 years. You know what I'm saying? Let's see how long we can go just leaving that area alone. But the difficulty is it's his favorite area to use. It's like your favorite car to drive.
Yeah.
But you have all these other cars that you have, but that's still your favorite car. All right, how you feeling? You okay? Excellent, excellent. All right, thank you.
Did great.
All right.
Good job.
Quite an MRI I just looked at.
Yes,
But
yes.
give me your history, what you've been through. I know you said you had a brace on when you were a kid. You have scoliosis.
Yeah, I was diagnosed when I was about in 8th grade.
Okay.
In 9th grade, I wore the summer of my 9th grade, I wore a Milwaukee brace,
Yes.
23 hours a day, took it off for 1 hour for showers for 11 months.
Okay.
From then on, I have very good posture, by the way, after that Milwaukee brace, because of the way
Held him.
it holds you together
Right.
for a couple of years. Then I just went to college, had to have guys kind of give me adjustments every once in a while because it felt tight,
So your late
by-
teens, 20s, you're getting adjustments.
by non-professionals.
Okay.
And then, every once in a while I'd see a chiropractor. I did self-adjustments for 10 years in my 20s and early 30s,
Okay.
but that was one way I could get relief. And then after a certain point, I couldn't do that anymore. It started, I couldn't do my neck anymore. I couldn't do my hips anymore.
Just to pause you, what was the main symptom you were feeling, let's say in your 20s? What were you trying to get relief from?
Tight lower back.
Just tightness in the lower back. Nothing
Yeah.
was going down the legs.
No.
Just some maybe sharp pain or just tightness?
Pretty painful.
Sharp pain.
Yeah.
With muscle spasms.
Yeah,
Okay,
muscle
got it.
spasms, I would
Okay.
assume, yes.
Okay.
As I've gotten older, I have noticed this IT band
Okay.
has become a real problem,
Okay.
and I've had chiropractors and masseuses use their elbow
right.
on it and get great relief. I owned a hot tub at one time, put all the jets, and would do my own treatment on that IT band.
Okay.
It would help. Didn't help that much on my lower back, though.
Okay. You said more recently you went and had some traction done. How
Yes,
long ago
one
was that?
time. I'm going to say about a year and a half ago.
So a year and a half ago, you have
A single episode of a table.
you're laying down and they're just pulling it.
Right.
So you got a severe scoliosis. They're trying to pull it straight. And what'd you feel?
I ended up for a few days nothing, and then I got huge muscle spasm in my mid back. Went to my physician. He ordered some MRIs and some other X-rays.
Right.
Went to 2 or 3 back surgeons. The last one said I would never do surgery on this. It's too. I said I didn't really come here for surgery, but
Sure.
he said no. You're going to have to live with this. You're going to. It's that your curve is going to turn 1 degree worse every year
Yeah.
from this point on.
Now, the symptoms you felt a couple days after that traction, were they in the area that usually bothers you or in a different area?
about the same area, a little bit higher than your hip is where in mid-back is where I really got a bad muscle spasm.
So kind of a reproduction, but at a higher level of what you usually
Yes.
feel, but just kind of really.
Right.
Right. Okay. So, like I said, I wasn't there. I didn't see it. But what I know with the spine is that we have parts of the spine that, like I was trying to say, that are stiff and parts of the spine that are loose. And even with the scoliosis, when you have a lateral bending, you have parts of the spine that are moving too much. And my worry with straight traction like that is that even though we have the good intention of trying to pull the spine straight, the loosest parts of your spine are going to move the most. So my worry is, how do we know we're not further loosening what's loose and not loosening what's stiff?
Okay.
Where I want to work with you today, and I'm interested as I feel your spine today, I have more information for you, is to try to target and identify the stiffest parts that are not moving and see if we can take stress off of and move around where, in a second I'll have you point where that was, and then try to move the stress away from it. Can you reach and tell me kind of where you felt the most discomfort, or how right now, where's the most pain?
You know what? After 50 years of this condition, I don't have real pain. I have real tightness,
Okay.
not much motion, but right up in here
Sure.
is where it
On the high
spasmed.
side.
Yes.
Yeah,
on
so
the high-
we call it the muscles, because the scoliosis, let me get a model. When you have a lateral bend, so essentially it always goes to the right in the chest and then it goes to the left in the lumbar. And this has to do with the heart being here on the left-hand side. Almost all virtual scolioses are always to the right in the chest. And then, so on the high side, the right upper and the left lower are going to be, not only you'll see the muscles pushed up because they're actually rotated, the vertebrae are rotated, they're actually going to elevate the musculature, and the muscles are tight because the bones aren't in the right position, right?
Okay.
So because of that laterality, the muscles are always going to have some level of stiffness that we're going to need to, work on, like massage or Gua Sha, and even some pressure on here to help get some blood flow into these tight muscles. Muscles build up a lot of lactic acid. The lactic acid can irritate the nerves. How long has it been since your last adjustment?
Oh, about 6 months ago.
And what do you usually go through? I'm just going to get.
The only sure things they can adjust is my neck.
Okay.
The lateral hip, I forgot what it's called.
Side posture.
Yeah. I used to do that on my own. They can't get much. The only that occasionally they'll give me a fist on my back, and they
Try
can
to
give
push your chest.
push. Yeah, a few.
Good.
That's about the limit of any kind of relief that I get when I go to a chiropractor.
How does that feel when they do the hug adjustment? Is there a lot of discomfort? Are you okay?
No discomfort at all. It feels great
Okay.
because I can't do it myself.
Okay. I'm just gonna give you an overview. I took a picture of your MRI.
That's a trip.
So your first recollection of this scoliosis, at least starting, was back when you were a teenager?
Yeah, young teenager.
Young teenager.
Mhm.
That's usually when they develop. What happens is as you're growing, the spinal cord is housed inside your spinal canal, which the bones are wrapping around. The spinal cord cannot grow as quickly as the bones grow. And so in an attempt to alleviate pressure on the cord inside there, the spine buckles laterally,
Okay.
right, to shorten the distance, essentially. And so you can't correct
Right.
structural scoliosis.
Understand.
Some semblance of this has to be here simply because your bones are taller than your spinal cord allows it to be.
Okay.
So the managing factor that we're going to have with scoliosis is keeping everything limber, making sure that the areas of the greatest lateral curvature are staying limber. They're going to want to tighten up very quickly. I find even with my own back, I have about a 19-degree scoliosis. I have to have a little bit more care, especially around those lateral areas, to keep them loose because they're always going to get tight.
Yes.
There's an extra level of muscular contracture going on in there because of the laterality. So routine adjustments to some degree, massage at the very least to keep that moving. What's happening, in my opinion, what's going on here is that there's actually a rotation. So the side that the scoliosis, see the curve is going to our right here, the vertebra actually rotates to the side. So it's not like it's fallen off, it's actually rotated. There's a rotational component along with a lateral bending component going on here. And this MRI is just taking slices, right?
Yeah.
We're looking at one slice here. Same thing going on with this vertebrae. There's a lot of rotation going on with this, and this way you'll probably, you'll be able to rotate one side real easily, and the other side's a lot stiffer because the vertebrae are already kind of rotated for you one way, and that'll affect your range of motion.
I have family members who tell me when I'm reversing the car
Right.
that I don't turn far enough. Well, I can't.
Right.
Yeah, I mean, I use a little bit now. I'm kind of limited to about here, so I've got to use mirrors and
So you can
prayers
turn
to
left.
change lanes.
So you-
Well, I can turn
Left.
better left than I can right. Yeah, which I need to turn right to look behind me driving.
What's causing that is the vertebrae are already essentially in a left rotation position, which then makes left rotating farther easier. Versus if they're stuck in left rotation, then you have to go from here. It's a huge distance
Yeah.
to go
Mhm.
to the right. The main thing that I see with this is we have 24 vertebrae, and very likely a large percentage of those aren't there working properly. And so many vertebrae, especially when they've been stiff for a long period of time, build up what we call plaque or crystals form in the joints that don't move. That takes only about 10 days to happen. Very quickly, joints can become frozen in the similar principle of what we call frozen shoulder, right? Somebody can
Yeah.
injure their shoulder and their shoulder can become frozen. That principle can be applied to any joint in your body. When there's stiffness in an area, the joint will start to become frozen, and then because one joint freezes, another one has to compensate. That's what I'm interested in checking. The adjustment is simply a way to speed up that process of unlocking the parts that are tight.
Okay.
Turning, okay, now turn to the right side. So same thing, a little bit more restricted, going to the right-hand
Yeah,
side.
I can't go any further.
Okay.
Like, so the goal today, like, what is your ultimate goal coming traveling here? What do you want from
Well,
him that you haven't?
I really want a little bit better understanding of how much better I can expect to ever get,
Okay.
or am I kind of here and then getting continually a little more stiff and a little more tight? I'm just hoping to be able
Sure.
to loosen up a little
Sure.
bit more.
What I generally see with almost every patient I see in my practice, I take 10, 15 years off. That's the most realistic, what we
Yeah.
call limitations of matter. That however you were feeling 10, 15 years ago, which hopefully wasn't
Better,
so bad,
yeah.
we can try to get you there and then hold you there is more realistic. I can't make you feel 20 again, but
Yeah.
by working on you and waking up some of the frozen areas, we can take off about 10, 15
Yeah,
years.
great.
So, have you start on your back for me. All right, take a deep breath in for me. I'm gonna go pretty gentle here. Keep the head back on that little headrest. I'm gonna go pretty easy here. Exhale, exhale. All right, deep breath in. I'm gonna go a little deeper in a second.
Yeah.
Breathe in, easy. All right, deep breath in. I'll go a little deeper. I got you, I'm learning you. Exhale. A little bit. Here we go. All right, one more. I got you, it's okay. Breathe. Let it go. All right, good. Stay there. Stay there.
If you go right around here, maybe you might get it a little lower.
A little lower? Okay. All right, deep breath in. I'm learning you. I feel it. Yeah, I'm trying to get it. Yeah, there we go. There it is. Yeah. He knows his back. Yeah, we got a lot of tightness in there. I wonder,
Yeah.
my worry is that the spine actually feels really healthy. Just from what I felt.
Yeah.
He's got a really strong back, but I'm actually more worried about the connections to the front.
Yeah.
Right? So what happens is, because we get rounded forward, these connections on the front can get jammed. There we go. I got your head. There we go. There we go. Everything's pushed out to the right-hand side here. We'll spend a little bit more time here on the right trying to unlock this right side. We'll get that. We can definitely improve your cervical range of motion, your ability to turn your neck. There we go. There you go. Very nice. Yep. Very nice. Okay. Relax right here. Let it go. All right, a little piece.
Yeah.
All right, we'll get some more. I wanted to get an idea of how your spine moved cold. So I wanted to see, which employees are showing up without anybody having to call anybody or, kick down doors. Now we're gonna do some soft tissue work to see what's the potential that I can unlock, right? Who can I actually get, off their butt to the assembly line and back working for you, right? And so it's like I'm getting a baseline first, and then we're gonna see how much I can improve it here. typically what I see, whether you have a scoliosis or no scoliosis, is that 5 vertebrae end up doing 99% of the work. Your wife asked me about arthritis, and it's like, well, yes, I can see some vertebrae are older than he is, but I also see a lot of vertebrae that are younger than he is. And my interest isn't in the older ones. My interest is in the younger ones and how much potential and capability that I have to restore the function in those areas that are young and stiff. And the more they're working for him, the younger he's going to feel, because you feel as old as the average age of the parts of your spine that work. If you only have the older parts working, I'm in a lot of pain. I have a lot of tightness. Tightness is a guarding. Your body, is trying to splint, protect and tighten joints that are injured. So on the high side of the rainbow, we call it. So if the scoliosis is like this, the high side would be the top side. The joints are separated. Think of the joints like a handshake. You have 2 vertebrae that glide over each other, right? Like a handshake. When the hands are overlapping completely, there's a lot of stability between the joints, right? But if we separate our hands and we separate the handshake, now muscles have to be used to hold everything together, right? Now, because you have a scoliosis, structurally, because the spinal cord or whatever reason is causing that scoliosis, we can't stop the reason for why those joints are separated. So those muscles are going to have to work, right? And so somebody needs to be behind them with some Gatorade, giving them some food. You understand? There's a lot of lactic. Correct. And maybe you have a weekly massage, and maybe you have 2 weeks. I don't know. More care might need to be done to alleviate that. Now, I believe the more we can get the parts of your spine that are stiff working, the less your body will need to guard the injured ones, the injured joints but they are separated. I can see on the MRI there, and they're separated to a large degree, which makes you lose the inherent stability of the spine, which comes from the posture, the joint overlapping, the alignment. And so, yes, muscles, and actually, I know you said that was one of your first symptoms back in your 20s.
Yeah.
Tightness, correct. That's simply the vertebrae aren't in the right position. I can tell people who've worked on you. I can tell this is, I'm just seeing what you can handle here.
Yeah, I've got a pretty good tolerance for
Okay,
this.
you're doing great.
Yeah.
Doing great. Okay. All right.
Side seems a lot sore, more sore, yeah.
Well, the left is going to be definitely your abuse side, right?
Yeah.
So the right side is locked.
No.
So the left side is going to be the side that what we call hypermobile. It's already, moving. The circulation, well, let's say this. The difference between an artery and a vein is arteries have 3 layers, veins have 2 layers. So there's a muscle, think of like a hamburger, right? You have 2 pieces of bread and a piece of meat in the middle. A vein is just 2 pieces of bread, right? There's no meat. So that meat, that muscle that's in the wall of the artery, essentially is what controls your blood pressure. That's what either relaxes and dilates or contracts and constricts, right? That's how your blood pressure is regulated, is through this. Now that muscle is what's supposed to be used to push blood into some of these areas. Now, because there's a lot of tightness, because the vertebrae aren't in the right position, some of those arteries have a hard time pushing blood to the top of Mount Everest. Now, oxygen's needed to help get rid of the lactic acid, right? That's kind of the cellular exhaust, the waste product that your muscles are producing as they are staying contracted. So what are you trying to do here, Ed? I'm trying to, 1, push, right? We're going to I'm mechanically pushing blood, bringing blood to the top of this mountain, and then 2, trying to actually loosen up the area so the mountain's not so tall, right? So it's not so much effort. Now that muscle, just like any skeletal muscle in your body, it can atrophy, right? If you don't use your bicep, right, eventually it shrinks. And in the same way, the circulatory system, the muscle that's in the artery wall, can weaken over time if it's not successful at pushing against that tightness. All right, there we go. All right. And please, if I'm ever going too hard, please let me know, okay?
That rarely happens.
Okay, all right, that's good to hear. Your family members heard you say that, okay? All right, I'm just... Well, you could have told him to back off. He asked you. All right, fair enough. I like being on that side of the fence.
Okay.
There we go. To some degree, the lateral bending of your spine has to do with the loss of your front to back curves. So We're supposed to have a curve in our lumbar and in our neck, front to back, not lateral, but front to back. When the spine starts to go laterally, it usually takes some of that curve or most of that curve out of our front to back curves. And so in some way, your spine can stay curved, but we got to move some of that lateral curve back into a front to back curve.
Okay.
In order to accomplish that, we use a device called a DenRoll. These are orthotics that we mold our spine. And at the end of our visit, I'll show you one. It emulates my hand like I'm doing on your neck right now. And I'd be very curious how it feels and how much time you could spend on it, because essentially that's how I would try to minimize your scoliosis. I have a unique way I look at scoliosis. I'm not, probably not something you can Google. I believe there's something called a baseline, that whatever his curve is, 60 degrees, some of that curve needs to be there. What I believe to some degree is you have fed it to maybe a larger than it needs to be. Does that make sense?
Yeah.
Maybe it needs to be 40, right? But he's fed it to 60. I don't know that. It might need to be 59 degrees. I don't know. But the goal with stretching and reducing your scoliosis should be to try to locate baseline. And everybody's different. Mine's 19 degrees. Some people's are, So we start aiming you in that direction. So they said that your scoliosis is going to keep getting bigger and bigger.
1 degree a year.
Well, that's the only reason that the scoliosis would grow is if the discs keep collapsing. So if the discs keep collapsing, right, the discs are made of water, about 70-80% water. And that's why they're saying that. They're saying that the discs are going to continue to dehydrate, and therefore it's going to continue to buckle because of disc dehydration. Now that doesn't need to happen. Discs don't, and that would actually then encourage me that we can reverse it if we rehydrate the discs, right? How do we rehydrate discs? Arching back, right? And so that would be the idea of loosening you up and then maybe starting with a rolled up towel, something to put in his middle back and start arching him back to try to keep his discs hydrated. The discs are like a sponge or like your ear. They really feel like your ear. They're actually close to it's cartilage. It's a spongy substance that is made of water, and if it's under compression all the time because we're forwardly rotated, then it dehydrates, and that's what's going to cause it to buckle and increase your scoliosis. So then where was the conversation of trying to rehydrate your discs? They didn't have it because they're not interested, because nobody really wants to
Take the long run.
right
Yeah.
take the long road. But that would be why why I'm permitted to say we can take 10-15 years off. We can undo some of that severity of that scoliosis. All right. The goal with any stretching is to bring you to your limit, right, and then back off a little bit, right? And where that limit is will change with care, with massage and adjustments. Hey, I'm going deeper, and we try to, it's like a physical trainer at a gym. I'm here to push you, but not overwhelm you. I'm here to try to find where the edge is, okay? Lift, and back off a little bit. And we try to hold. So posture is through stretching for about 20 minutes. It takes 20 minutes for ligaments to start being altered. It's unlike a muscle, which you can stretch in a few minutes. Ligaments take a little longer, about 20 minutes to reach their fatigue point. So we have to try to get your spine in the right alignment and then hold it there for 20 minutes and then see how your body responds to that, stretching essentially. I'm waiting. There it is. A little bit, good. All right, easy. Good, all right. Let me have you sit up for me. I'm just gonna feel here for a second, just keep breathing. You're doing great, breathe. There you go. All right, yeah. Yeah, you need these poor areas are in lockdown right here. They haven't been fed in a while. Get some meals to these guys. All right, I got you. All right, I got you. Easy, yep. Exhale. All right, let's go to the side for me, this side.
Don't feel bad, you're getting any movement there.
It's okay,
Yeah.
I feel the tightness. I feel what we're up against. There we go. All right, I got you. Okay, I got you, not gonna fall, I got you.
Okay.
I got you, not gonna fall.
A little guarding on my part.
I got it. Let's go face down for me. But yeah, these joints are going to be a lot of, like right there, that's the peak. There's going to be quite a bit of mark coming out right here. So, based on the amount of lactic acid that these muscles have accrued. That's it. That would be the way it. So we want to. You're going to see me working on the high side, heavily on the right, heavily on the left, trying to compress. And like I said earlier, my worry is, with those type of tractions, they can't discriminate, right? They only it mainly moves the parts that are loose and doesn't move the parts that are stiff. So, we're not really effectively balancing the elbow, and with my hand behind your back, I can kind of isolate certain areas and target certain areas. Even though, yes, to some degree, every vertebra is going to move, 95% of my force went into the area that I wanted, and very little went into areas that I didn't want. And it's a targeted adjustment, we call it. Doing okay with this pressure? Go a little deeper? What do you think?
You can go deeper, sure.
Okay, all right, here we go. I'm learning you. Any joint that was not moving, that I get moving, isn't going to like you tomorrow, okay? So don't be disheartened.
No.
Okay, fair enough.
Actually, I feel like a healing hurt, so
Okay, all right.
I'll be good with it.
All right. I've never been accused of going too easy on someone. I've never had, Dr. Ed, I really didn't feel much. Never been told that. Keep breathing. Come on, there you go. Good. Uh-huh. All right. All right, take a break. Yeah, okay, all right, I got you.
I'm good. No.
Okay, all right. Right there, yeah. It's actually really, most of it's in your lumbar. There's really not much. There's a little right here.
Right there, yeah.
There's not a whole lot of right. It's mainly a left lumbar curve. Yeah, the SI joint's an interesting one. It's an angled joint, so you almost have to go, it's not P to A pressure on it. Like the spine, I'm going directly this way. With this, you almost have to go, it's like a lateral, almost 45
Yeah, right there.
to get right into that.
From that direction.
Yep, it's got to be right there.
This really bothers me when I sat too long.
Uh-huh.
Just like most of my days, isn't it, Gail?
You gotta keep the couch from flying away. If it's always floating away, you gotta lay on it. Yeah, right there. This is where the muscle is. So the muscle that the tensor fasciolatum muscles are up here. TFL muscle right here at the top of the greater trochanter, goes up to the ilium, right there. So this muscle is a stabilization muscle, and obviously it's just being overworked. And
Not really feeling anything up there on
Okay.
those last ones.
okay, good. Yeah, right there. Yeah, big difference. Feel the difference here?
Oh, yeah,
Okay. This
yeah.
is why your left knee, it's not a coincidence that the left knee had a total knee replacement and the left glute here is all filled with fluid. Back, take breaks and do a couple rounds.
That's mid-back, right?
Right, lumbar one, yeah, there's about lumbar
Okay.
one right here, T12, about thoracolumbar junction, right
Yeah,
there.
yeah.
Diaphragm attachment, quadratus lumborum attachments in here. Lats, traps, big intersection right here.
Amy, if I need to tag team, let you in, will you take it? Okay.
Gladly.
I don't get tired that easily.
No, for me.
Whoa! Yeah.
Yeah, yeah.
What's difficult with just palpating a scoliosis is that the vertebrae, the spinous, will rotate back to midline, right? So if I just did the spinuses, you understand?
So it's-
There's almost no
it's
scoliosis, right? Because you
rotated
can't trust the
deeper.
spinuses.
Gotcha.
Because the
Usually
vertebrae is
it's-
way over here,
Right.
but the spinous is still in midline, right? So, right, it's still the bump that you can feel on your back called the spinous process is I'm running my hand down the spinuses. Those are, but the vertebrae are way over here. Because what happens is the vertebrae has wings on them called transverse process. When you rotate the vertebrae, the transverse process pushes up all the tissue, right? That's what you're seeing is the bump here.
Okay.
You're mainly seeing the rotation, the laterality, which it's really the rotation, not so much the vertebrae over here. The rotation raises this and elevates this, but the spinous is right there. There's the spinous. It's only like a quarter-inch off to the left. You understand? So it's called coupled motion, but the vertebrae rotate back to midline. So, but if I was gonna,
Follow.
so it's definitely elevated. It's a minimally. I would say it looks like this. Goes to the right here, and then it goes more severely to the left. So the marks are like you see the darkest comes right over the peak there. Where the most acidity is also going to be where it's the stiffest, where it's the most misaligned. Those are all going to correlate. The most difficult concept with the spine to understand is that only half your spine has feeling. So a lot of practitioners are going to have a inclination to want to round you forward, to take weight off the things that have feeling, right, and put it on the weight. structures that don't have feeling, which is then what made that doctor say that your spine's going to buckle more every degree every year, because the more you round forward, the more those discs dehydrate. But it has the capacity to give us temporary relief, not to the tightness, just to nerve pressure. And Ed, we might not have nerve pressure, but you're in avoidance, so you would if you weren't avoiding. And so this is one of the concerns as we start arching you back, which will start at the end of the visit. You're in avoidance. So as we unavoid you, we're going to run into the things that you're avoiding. You're hurting me. No, I'm making you confront the things that you ran away from. Now, as we stand you upright, the muscles will get a break, right? That's why I asked him, what's your main symptom? The tightness. That's because of the alignment and the forward rotation. But just understand that we're going to go into the areas that he's been running away from, and with that, it's like going up into an attic and moving boxes. I got a brown widow bit me. I shouldn't have been up here. Well, I'm moving stuff around, and sometimes things that are hidden will bite you. Millimeter by millimeter is how it leaves the same way it arrived. It slowly grew, it slowly diminishes.
Does it feel like that?
Oh, it just feels like a...
Yeah. No, this is the more.
Just like a back scratch?
Mhm.
Yeah,
Mhm.
yeah.
Yeah, they've done this for 1,000 years. This is the way before chiropractic was started. They were combing people,
Yeah.
just blood flow. Right, it's what the muscles need. The muscles need oxygen to bind to lactic acid to form carbon dioxide and water. Right, so the whole purpose of breathing oxygen is to actually remove acidity. And then your body hydrates itself. Isn't that cool? Your body hydrates itself by burning energy and producing and dealing with lactic acid. Your body hydrates and then makes carbon dioxide. Then exchange occurs. There we go. And then there's some hair on the top. This is the high side on the right here. You can see. Kind of.
Because not a lot came out.
Correct. Yeah. No. This is the high side on the right. That's the. Yep. Yep.
Yep.
Yep. He knows it. Oh yeah. Oh yeah. That's the good spot right there, Ed. The yep heard round the world. Yep.
It's the question that nobody answers. But when you find it, you know it.
Going by every vertebrae and saying, can you help a little bit? You're not injured. Can you help out? Can you bring some assistance to this team? Right? That's all we're doing. We're just, the adjustments hurry it up, right? If you just did massage, it would, to me, take way too long. The adjustments can get it done in a more reasonable time. If you do both together, then they kind of amplify each other, right? Just adjustments alone takes longer. If you just did massage, it takes longer. So you combine everything. Do you have everything, Gua Sha and stretching? You combine all these elements. I think of it like the grocery store Publix, you know. They combined everything. You have you have a bakery, a butcher shop, you have a produce, they have everything, right? They used to be, I believe, my understanding is that everything was a separate place. You had to go to a butcher shop, you had to go to a bakery, and then we combined it all into one building, so you didn't have to make multiple, right? And that's what I think the McLaughlin technique, the McLaughlin method, is to, you know, put it all in one, right? So you don't just adjust and do soft tissue work and stretch, and you complete the whole package of how do we restore spinal health. There we go. Yeah. Okay. Right there.
You found another one.
Uh-huh.
It didn't really hurt, but that's a protective mechanism.
Mhm,
But I feel it down there.
Mm-hmm. Yeah, I would first kind of go big. We're going to take a rolled up towel. We're going to lay it right here and see how upset he gets at us. That's the first thing we're going to, you know, there's all sorts of advanced things. We can do pressure just on one side. I'm not going to go in there. You know, that would be like visit 5, 6, 7, where you do start testing out what happens if we just place it on one side, right? But for now, we're just going to use both sides, and we'll just see how. They make a device called a Scoliosis, where you're actually laying on your side. You know, again, these are, if you're wondering, why haven't you talked about this yet? It's on the Chiropractic Biophysics website. That would be like month 6. Do you understand? There's a process. There's other tools that I haven't talked about. The first phase of this kind of care is what I call the demolition phase. You want to make sure everybody moves. And with just getting everybody moving, he's going to have an immense quality of life improvement. Just by mobilizing and restoring function to all the tight areas. Right. So if I hold something close to my body, I don't have to do as much muscular work if I hold it close to me. If I hold something out extended, my muscles work harder. So it's like, well, I got a lot of tightness.
Yeah.
Right, because you're in a position it should be here, and then the muscles can relax. So based on the position the vertebrae are in, with that, there's going to be, and then lactic acid and, you know, pain. This is where some level of massage and work to, you know, hydrate this tissue, but mainly to make it last longer, counter stretching up to the point where we annoy him too much. You're gonna when you start undoing this, you're gonna run into everything that you ran away from to get here, and then the understanding of baseline, right, of you know, how much of this laterality needs to be here simply because your spinal cord is not long enough. They call it spinal cord tethering is what it's called, and that was a seminar, I don't know, a decade ago, and they were just, you know, this hasn't been understood for more than like 20, 30 years. This isn't like, you know, when you were having the Milwaukee breaks, they didn't understand this. You understand? They didn't understand that your spinal cord wasn't long enough. It's only maybe in the last 20 years they've really, at least mainstream in chiropractic, or at least the postural part of chiropractic, has understood this. Essentially, MRIs weren't invented until the 70s, you know, and so you had to be able to pull it straight and then take an MRI of somebody to see where the brain is, and we started seeing the brain starts to get pulled into the neck. Do you understand? So because it's not long enough.
Sure.
So you gotta stop. You can't pull your brain into your neck. The pons, the medulla, they should be right at the foramen magnum or just above the foramen magnum. They started seeing the pons and the medulla start coming down into the neck. Yeah, let's not do that. And then constant head. You can't lengthen your spine.
You
You know,
can't.
maybe. Nobody's talking
Yeah.
about that.
Yeah, no, okay.
I would love to have mine to be lengthened, but no, I mean, yeah, grow your nervous system, grow your spinal cord.
So
Good luck.
You have that first.
Well, what the talk is on is that the filum terminale, the spinal cord attaches to your tailbone, and there's like a cord that wraps around your tailbone that it is tethered to. So the idea would be to like untether that and untether the bottom end,
Mhm.
right?
Can't do.
Well, you might cause a lot of pain.
Yeah.
You might cause more suffering going in there, messing with that. Now I got constant sciatica because whew, again, I'm not a surgeon, but I'm just saying, I bet you somebody smarter than me has looked at it and said, no, we're just going to put braces on it and, you know, painkillers and, you know, I don't know, it's too much. Maybe one day, I don't know. We'll get there. I don't know. I'll keep posted. I'm watching. I read the journals. I don't see anything about surgery on the spinal, other than young people, and then they end up, to me, causing more problems immobilizing it. Because if you immobilize it, I just got done telling you that the tissue keeps itself clean through mobility. So now you put a rod in there and hardened it. Okay, maybe you fix some of the structure, but now you have all this inflammation built up from it not being able to wash itself through mobility. So immobilization isn't a great end game either. So the muscles primarily in the quad and the side of the knee. The tighter these muscles get, it puts the knee under a vice grip. So, you know, part of it is even how you walk, you know,
Right.
because this is shifted over here, you favor this side, which then tightens the muscles, that then vice grips the knee, that inflames the nerves that go to the knee. They're all of this is additive in its effect on the knee. But the reason why your left knee had a total knee replacement and your right didn't isn't a coincidence. It's, you know, this is where extra stress was going, and then okay. Okay. Yeah, right there. Yep. There you go. Yeah, just gotta find the spot, and eventually it fatigues out, and then. But again, these. It's not like these muscles are the problem. These are just the effects
Yeah.
of they're hard-working muscles in here that aren't doing anything wrong. They've just been tasked with an impossible task, and now, you know, they just are doing the best they can. To some degree, you need, you know, all these areas need to be hydrated. And there you go. Mhm. Right there, yeah. Show me your range of motion. Just lift up your arm from the side. Uh-huh, uh-huh.
I can go higher, but
Uh-huh.
Yeah,
That's about-
yeah.
Uh-huh, uh-huh.
We're sitting over here doing everything.
yeah, with your high range of motion.
Never thought of it.
I just remember having a fall cleaning that hot tub 25 or 30 years ago.
Okay.
And about 25 or 30 years ago, I fell on the ice getting the newspaper, and both times my shoulder shot up.
Mm.
And I think I'm just now, as I get older,
Mm-hmm.
those demons are.
Right, the little bodies you buried are
Mhm.
now saying,
Yeah.
hey, you remember me. Your body doesn't forget.
yeah, you can mask it. It
right.
doesn't forget.
Every scar, every cut on your skin, you could show me something that happened when you were a kid. And
Yeah.
yeah, internally, it doesn't forget either. A little bit there, but not. A little bit of a mark, but nothing crazy.
And the paper didn't have anything interesting that day.
Oh,
You know, one of
man.
those-
Oh, jeez. Bait and switch.
Yeah.
Right. Definitely didn't have anything interesting when you were injured.
Yeah.
You're like,
I couldn't move my arm to turn
There
the
better be
pages, so I couldn't read the front page.
there better be some coupons in this. There definitely is a genetic component for structural scoliosis that essentially, like I said, the bones are growing more than the spinal cord just doesn't have the genetic information to grow at the same rate, or even I think it has to do with growth spurts, that when you have a spurt of growth, the bones can grow faster. So the actual growth of the bone stimulates the spinal cord to grow, right? And nerves can't grow as quickly as bones can grow. Now, if you grow more steadily, then you don't have scoliosis because they can kind of stay in tune with each other. But when you have these giant spurts of growth where you're like, I grew an inch in a month, the nervous system can't keep up and it buckles.
So that's why we start looking for scoliosis with kids at 11,
Right.
12,
Well, you
13,
wanna-
right in those years at the growth.
You want to stimulate the spine all through their time of growth, right? Through chiropractic, right? You don't just wait for growth to stimulate the spinal cord to grow. You want to many kids are sitting 14, 16 hours a day, right?
Oh,
right.
yeah.
These
Sure.
are the,
I see that.
it's all that
Okay.
lactic acid
Yes.
there. More
I see
on
the
the
space.
left side
Yes,
there.
uh-huh,
And
right.
there's some even on that right upper.
Mhm. None on those ribs, but all these ribs. Yeah.
Muscles are tighter.
Mhm.
I got you. I got you. It's okay. There you go. Let it go. I got you. Breathe. There you go. Yeah. He's. There you go. Yeah. It's okay. I got you. Not asking the joint something to do something outside what they're meant to do. They're meant to move around just like your finger knuckles are designed to bend, right? Now, if I asked you to bend your finger knuckle, you're saying you went like that. Well, that's pretty good. No, it's
Yeah.
not.
Yeah.
It's supposed to do that, right? The
Yeah.
joint's supposed to bend fully, and so sometimes we lose. I got you. Easy, real gentle. Good. Okay. Easy. I got you. Yeah. There you go. Yeah, you have a lot of power, man. If he doesn't want a bone to move, I got you. There you go. Wow, he's got power. I gotta trick him to get the bones to move. Exhale. I got you. Easy. There you go.
Oh, yeah. That was an interesting one.
Being careful on your surgery side here, but easy. I got you. Okay, all right. Hand around your hip for me, just like that. There we go. And then you're gonna press back right there. Yeah, we moved. Yep, good. Kind of a silent click, but it moved. Yep. Push. Good. Good. All right. Let me just check ears here. There we go. Go ahead and tilt your head left. So we're just gonna tilt that way as best you can. Just give me a little resistance. One
Yeah.
second. Keep your head straight.
Okay.
And then go ahead and tilt left. Good. Go ahead. There we go. Good. Okay. All right. Now we're gonna go to the right. Go and tilt right. Good. And then tilt to the right. Tilt right. There we go. Yep.
Tony, let's yeah.
Do good. Hands feel good. Yeah. No. See, he's pretty tough here. All right, take a deep breath in. And back. Wow.
That was something.
All right, breathe. I got you. All right, one more. All right, last one. Good.
Cool.
Yeah, those bones have not moved in a long time.
You're
That
gonna
was-
workout.
That was like 3 or 4 there.
Yeah, it was. It was.
Well, correct.
My
Yeah,
hips.
let it arch. Yeah, let it arch. The idea is actually let your body just sink into the floor.
Right.
You just relax onto the molding device is ultimately the goal.
Oh.
You know, you shouldn't have to do any active,
Okay.
lifting. You're just incrementally increasing the size of what's behind you, and your back will simply mold to
From a
it.
massage standpoint, what should I have that, work on?
Well, I
Because,
would- Where I worked on you today, I mean, it's pretty simple. That right there in that middle back on the left side, you're not going to change the position of anything massaging or adjusting.
Yeah.
It only can be done through what I'm trying to show you right here. Because your back is unlevel, the side that's higher will get more pressure. So you'll feel like you're crooked on it, essentially. But your back's unlevel. You understand?
Yeah.
And then as you do it more, it'll start to level out and you won't feel as crooked. But exactly, you place, and then you move this. So right now you have this like kind of up here,
Yeah.
and this could go a little lower. But the whole chest area, from really here to even all the way up to here,
Yeah.
the whole chest could be targeted. It'll be more difficult lower. It'll be less difficult higher. It's going to be more difficult where the misalignment is the largest, right? So we want to target the peak of that misalignment.
Well, you've probably seen those braces that people can put on to increase their.
Right.
It's really more of a suggestion to you to stand up straight with your head out, or does it?
Well, it's to me you're robbing and paying, right? So you're forcing somebody to be upright,
Yeah.
but you're also stiffening them.
Oh, I see. Because
Right.
it's going like this. Yeah.
Because spinal health is a combination of alignment and mobility, right? So you're sacrificing mobility, right? We're stiffening you, but we're making your alignment better. So are we really netting
Any goal.
Maybe
That's a good question, Yeah.
though.
Well, because I saw a picture that Justin
Maybe.
took of me holding Leo's hand, walking toward the house.
Yeah.
And it was like,
Yeah.
I thought to myself, that is really an ugly looking posture.
Well,
You
you
want-
don't realize how much you're.
You do.
I know.
Yeah.
And
You
you're
want to
judging
have
your
good
head forward
posture.
Like this.
Yeah.
You want to have good posture and that be where you want to be.
Yeah.
How you feeling? You okay?
I'm feeling great.
All right, wonderful. Thanks for
all your
dropping in.
work.
Thanks for flying in.
No, thanks for all your work you did.
You did great. Thank you.
Okay, thank you.
Appreciate it. Thank
Wow.
Shot like a picture because I've tried to.
This thing is so tight.
Oh, you just ripped it.
That is seam or a back?
No.
All right, I want you. Yeah, that. So if you could both, so you can see his, you can
sure
see it.
can.
Yep.
You absolutely. But if you could see it from our view, it is really interesting. Good
So you can
idea.
see